More than half of the United States will have begun reopening by tomorrow. At least 30 states now, including the 13 we mentioned earlier, who take their first steps to reopen their economies this week. This, as some doctors say, the lockdown is causing other health issues to go untreated. Joining us now, Dr. Jonathan Baugh, Chief Medical Officer at Remote Health Solutions in Utah. It is one of the states preparing for a soft reopening tomorrow. Dr. Baugh, in your view, is it time?
Yeah, John, one of the things that I've talked about for quite a while now is the fact that this definitely needs to be regionally and geographically driven. Here in Utah, our numbers are definitely better than many other places. Now, whether that has to do with the quarantine or whether that has to do with early exposure or what all those factors are, we're going to take a long time figuring that out. But definitely regionally, I know that we're some areas need to open right now, and I think that we're there in some areas, including Utah.
We have a list of the top 10 states for coronavirus cases. Utah not among them, and you're saying, and there's the list: New York, New Jersey, Massachusetts, and so on. You're saying that the response to this cannot be a nationwide response. It has to go state by state.
Yeah, I think it has to go by state, and maybe even smaller regional areas within states. I think we need to let people, governors, mayors, all have a big influence. They know their regions well. They can watch the numbers. I've been pushing the same rules that the president has brought forward through his team. The fact that we need to watch those numbers fall, both new diagnoses and ICU admissions and deaths. Those are key factors, and then we need to be able to do some continued testing, whether it's the antibody test to be able to know when we're reaching that herd immunity, and also the individual new onset test to be able to say who's getting the new disease and who's getting COVID-19 now, not just in the past. And then we need to be able to do some isolation, some individual isolation in areas. That way we can open up economies. We can get people back to work. We're schooling at home, we're working at home, we're going to church at home. We need to let people get back to their life, and we can do that as we monitor people at home with technology like we do at Remote Health Solutions, or testing and isolating those individuals who are most at risk, like skilled nursing facilities, nursing homes, and maybe even prisons and such.
I spoke last night with Dr. Daniel Erickson, one of the California doctors who put a video out on YouTube saying, let's get this country reopened again. COVID-19 is not as dangerous and as deadly as we thought. He got thrown off of YouTube for that. But he says, look, the death rate is not as bad as we have been led to believe. Are you at all concerned that as Utah and these other states start to reopen, that we're going to have a spike in new infections and perhaps unnecessary deaths?
We may see a spike, and that's why I'm a big advocate of continued testing and being very vigilant, watching our individual cases, our individual hospitals, our individual regions very closely, because the last thing we want is more unnecessary deaths. But what we do know is the more rural areas definitely are not the same as the more densely populated areas. And as we watch those new numbers come forward, we can make those good decisions. Now, I definitely do not agree the fact that this is not deadly. I talked to my friends on the East Coast in New York specifically. That's been a war zone, and we don't want that to be other places. But we also know that geographically, population density-wise, and many other factors make many other areas not like New York, not like New Jersey, not like Michigan.
We know that the virus obviously has killed too many people in this country. Are you finding that you're an emergency room physician, among other things, are you finding that people are scared to simply come to the hospital, even for, appendicitis and things like that, because they don't want to get the virus?
Yeah, definitely. I know that we saw a big decrease in our ER visits in the hospital that I work in for quite a while, and people specifically said they were anxious or nervous to come to the hospital because they didn't want to get exposed. And so were those diseases still going on at home? Sure they were, and surely we missed some things because people were anxious to come to the hospital. And we talk about other things, that surgeries that were not done because of the COVID. I talk about my scribe when I work in the ER. She has a heart arrhythmia and she needs a surgery. She needs a cardiac ablation. She hasn't been able to get that because of COVID. She will be benefited when we lift that ban on elective surgeries.
Dr. John Baugh reporting from Utah. We appreciate your thoughts tonight. Thank you.
Thank you, John.
President Trump returning to the White House from Camp David ahead of tonight's Fox News virtual town hall, where he will answer viewer-submitted questions on reopening the economy.